what I'm going to do is I'm going to walk you all through what the RIRS that Dr. Tan has mentioned is all about. So imagine you have a stone in the kidney. You want to pass out a very tiny flexible scope up the ureter essentially from the urinary opening all the way up. But in order to do that, you need to pass a few wires and other stuff just to guide the device in. The current state of affairs is that we use an access sheath, which is basically the thing we put in to get the ureteroscope all the way up there. The ureteroscope is a smaller instrument, it's finer, it's more maneuverable, but it's also a bit softer, it's harder to push. So access sheet guides it up. Then we insert the scope, we look for the stone, and then we insert a laser fiber, all coaxially through the same tube, which is the ureter, right? Once we see this stone, the fiber is aimed onto the stone, then we can fire it. That all sounds very straightforward. We go to the next slide. This is a video. Ignore what people are saying on the video, but look at the video. What you're seeing is stone fragmentation in real time. Now, of course, it's a little bit blurry, but what you can see is that because of the dust, the vision goes away. And in order to see a bit better, what happens is that the surgeon may adjust his scope position, which we handle with one hand. He also adjusts the laser position just to push forward and back a little bit. And in doing so, you may actually go beyond where the stone is and hit the tissue behind it. If you pull it back too far, you may actually hit your own scope, and that will damage it completely. The third thing I want to say is that because the dust that floats around, it's not so clear in the video today, but if you can come, I can show you if you're around when you're with me, that the powder actually obscures our view a lot. So we have to stop and let the fragments settle before we continue. The final thing I would want to say is that, yes, this all looks very well and good, but actually the patient's moving. So what we think is a good position to start off with, as a patient breathes, our equipment moves internally, and there is a risk there that we actually have shifted from what we were attempting to fire. So vision is critical. Next slide. So what's the current solution? The current solution is to try and suck out more of the fragments using what's called a suction access sheath. And how do we apply that? The picture on your right, it shows a suction access sheath in action. Okay. It's a very simple video, but you really can't see it. Basically, by applying a negative pressure to the outside of the lumen of the access sheath, you're generating a negative pressure which preferentially sucks fluid out. Seems very straightforward. The only problem with that is that it doesn't really suck out the fluid where I'm interested in, which is exactly where I'm firing the stone. It kind of evacuates the system, very much like an aquarium filter. So if you have an aquarium at home, a fish aquarium, and you're seeing how the flow of the fluid out of the filter is, circulating very nicely, but what is happening at the entrance to the filter is actually very slow flow. You go to the next slide. I've illustrated this kind of in a diagrammatic form. So you see the access sheath on the outside, the scope going through that, and the laser fiber going through that, hitting the stone. And as the fragments, as the laser breaks the stone, the fragments are floating around. And what does the irrigation fluid do? It generates eddy currents, which kind of floats everything around, and you're swimming in a cloud of dust. So the difficulty here is, how do I suck out my fragments better, right? And of course, if you don't break the stones into as fine particles as possible, the fragments tend to clog the channel. Dr. Tan has also alluded to pressure. So if your fluid is not draining very well, your pressures go up. So the only best way to remove the fragments is to really increase the lumen size. And by that, we pull out the scope. Then you're using the entire access sheet to evacuate, right? So but if you pull out the scope, then you of course can't see a thing. Next slide, please. So what can we do? We could potentially, if we consider the urethric access sheath, the scope, and the laser fiber as one unit, and see how we can design around that, we may be able to first improve the flow of the effluent, of the fluid coming out. If we can design it so that there's greater space between the access sheath and the scope, that will improve your flow of bigger fragments coming out. If we treat it as one system, we may be able to suck at the right place, because you can see that if I push my scope very far in, it's very far from where the access sheath is. And I can say that if we can take from other parallel technologies such as deep sea drilling or tunneling, how do they evacuate the fragments they want as they drill into the deep earth? And is there any way we can maybe simulate this so that we can see what kind of designs, and maybe an out of an ordinary design, very much like an aileron of an aeroplane wing, is not something we would think we would want to do, but that reduces eddy currents around the wing. Is there any way we can reduce eddy currents to make it more laminar flow so that the fragments are floating in the correct direction? The next slide. So that's my challenge to you, is that if there's any way we can design the system as one, not just individual components that we have to put together, but design as a concept together that may solve this problem. Is there anything we can do in terms of just the basic understanding of how we can make things flow better within the kidney? And any ideas you think that will be useful in trying to evacuate the fragments well so that we can see better without increasing the pressure and increasing the temperature. And with that, thank you very much.